I want to start with something that might surprise you. Right now, as you're watching this video, there are roughly 37 million people in the United States who have diabetes. 37 million. But here's what's even more startling. Nearly 1 in 4 of those people don't even know they have it. They're going about their lives, feeling fine, having no idea that their body is struggling. And that's just the diagnosed cases. If we add pre-diabetes to the mix, that early warning stage, we're looking at over 100 million Americans at risk. That's 1/3 of the entire population. Now, I get it. When you hear diabetes, you might think of something manageable. Maybe you know someone who has it and they seem fine. They take a medication, watch their diet, and they're okay. So what's the big deal, right? Here's the thing. Diabetes isn't one disease. It's actually several different diseases that happen to affect the same thing, your blood sugar. And if you don't understand the differences, if you don't know the warning signs, if you think it only happens to certain types of people, you could be missing one of the most important health messages of your life. Today, I want to walk you through diabetes. All of it. The different types, why they happen, what they do to your body, and most importantly, what you can do about it. Because whether you have diabetes, you're at risk, or someone you love is facing this diagnosis, this conversation could genuinely change how you approach your health. Let me start with the basics, because to understand diabetes, you need to understand what's actually happening in your body. Your body runs on fuel, just like a car. That fuel is glucose, a type of sugar that comes from the food you eat. When you eat, your digestive system breaks down carbohydrates into glucose, and that glucose enters your bloodstream. Now your cells need that glucose for energy. But here's the problem. Glucose can't just walk into your cells on its own. It needs a key to unlock the cell door. That key is insulin. Insulin is a hormone produced by your pancreas, a small organ sitting behind your stomach. When your blood sugar rises, after you eat, for example, your pancreas releases insulin. That insulin acts like a key, unlocking your cells so glucose can flow in and provide energy. It's a beautiful, elegant system that works seamlessly in a healthy body. But diabetes happens when something goes wrong with this system. Either your pancreas stops making enough insulin, or your cells stop responding to the insulin that's there. When that happens, glucose stays stuck in your bloodstream instead of getting into your cells where it's needed. Your cells are starving for energy, but your blood is flooded with glucose. And that's when the damage begins. Now, there are actually several types of diabetes, and understanding which type is crucial because they have very different causes and very different treatment approaches. Type 1 diabetes. Type 1 diabetes is what we used to call juvenile diabetes, because it typically develops in children and young adults. But let me be clear, you can develop type 1 at any age. I've seen it in people in their 40s, 50s, and beyond. Here's what happens with type 1. Your immune system, the system that's supposed to protect you from infections, makes a terrible mistake. It attacks the cells in your pancreas that produce insulin. These are called beta cells. Your immune system treats them like invaders and destroys them. Over time, your pancreas loses its ability to make insulin altogether. We don't entirely understand why the immune system does this. There's a genetic component. It tends to run in families. There's probably a viral trigger involved. But the bottom line is, it's not your fault. You didn't eat too much sugar. You didn't get overweight. You didn't do anything wrong. Your immune system just malfunctioned. When type 1 develops, it usually comes on quickly. People notice they're incredibly thirsty. They're urinating all the time, waking up multiple times at night. They might lose weight rapidly. They feel fatigued. In some cases, if it goes undiagnosed, people develop something called diabetic ketoacidosis, which is a life-threatening emergency where the body starts burning fat so rapidly, it creates toxic acids in the blood. The challenge with type 1 is that once those beta cells are destroyed, They don't come back. There's no reversing it. This is why people with type 1 diabetes require insulin therapy for life. They have to inject insulin multiple times a day, or use an insulin pump to replace what their pancreas can no longer produce. Now, I want to address a common myth right here. People often confuse type 1 and type 2 diabetes, and they assume they have the same cause. They don't. Type 1 is an autoimmune condition. Type 2 is metabolic. They're completely different diseases that happen to affect blood sugar in similar ways. Type 2 diabetes. Type 2 diabetes is the most common form, affecting about 90% of all people with diabetes. And this is the one where lifestyle factors play a significant role. With type 2, your pancreas is still making insulin. The problem is your cells aren't listening to it anymore. They've become resistant. Think of it like a key that still works, but the lock has changed. The key is still being inserted, but the door won't open. This is called insulin resistance, and it usually develops gradually over years. At first, your pancreas compensates by making more and more insulin, trying to force the cells to respond. For a while, it works. Your blood sugar stays relatively normal because you're flooding your system with extra insulin to overcome the resistance. But your pancreas can't do this forever. Eventually, it gets tired. It can't keep up. And now your blood sugar starts to creep up. Here's what's important to understand. When you're in that early stage, when insulin resistance is developing but your pancreas is still compensating, you often feel completely fine. You have no symptoms. You're going about your day feeling great. But inside, your metabolism is shifting. Your risk of heart disease is going up. Your arteries are being affected. Damage is beginning. What causes insulin resistance? Multiple things. Excess weight, particularly belly fat, is a major contributor. Physical inactivity is huge. A diet high in processed foods and refined carbohydrates contributes. Sleep deprivation plays a role. Chronic stress. All of these factors together create an environment where your cells become resistant to insulin. Now, here's what people get wrong. They assume type 2 diabetes only happens to overweight people. That's not true. Yes, weight is a risk factor. But thin people develop type 2 diabetes too. Genetics play a role. Age is a factor. Your risk increases as you get older. If your parents had diabetes, your risk is significantly higher. The warning signs of type 2 are often subtle, which is why people miss them. You might notice you're thirstier than usual. You're going to the bathroom more frequently. You're feeling more tired than normal. You might have blurred vision. Small cuts or bruises seem to take longer to heal. You might develop dark patches of skin, usually in skin folds. That's called acanthosis nigricans, and it's a sign of insulin resistance. But many people have none of these symptoms. They only find out they have diabetes during a routine blood test. Prediabetes. This is the stage I want to spend a moment on, because this is where we can actually change everything. Prediabetes means your blood sugar is higher than normal, but not high enough yet to be diagnosed as diabetes. Your fasting blood sugar is between 100 and 125 milligrams per deciliter, or your A1C, which measures your average blood sugar over 3 months, is between 5.7 and 6.4%. And here's the critical thing. Prediabetes is often reversible. Studies show that if you're diagnosed with prediabetes and you make serious lifestyle changes, losing even 5 to 10% of your body weight, exercising regularly, improving your diet, you can actually reverse it. Your blood sugar can come back down to normal. You can avoid ever getting diabetes. But most people don't take prediabetes seriously. They think, well, I don't have diabetes yet, so I'm okay. They get the diagnosis. They might feel a little concerned for a week, and then they go back to their normal habits. And that's when prediabetes progresses to type 2 diabetes. I had a patient named Sarah who came in for a routine checkup. She was 52, felt great, thought she was in good health. But her labs showed prediabetes. Her fasting glucose was 112. I told her she needed to make changes. She could prevent diabetes if she acted now. Sarah took it seriously. She started walking 30 minutes a day. She cut out sugary drinks and processed foods. She lost 15 pounds. A year later, her fasting glucose was 98, normal. She had reversed her pre-diabetes. But I see plenty of people who don't take that action, and within 3 to 5 years, they're back in my office with a type 2 diabetes diagnosis. By then, the window of opportunity to reverse it has closed. Gestational diabetes. This is diabetes that develops during pregnancy, and it affects about 1 in 20 pregnant women. During pregnancy, hormonal changes make it harder for your body to use insulin effectively. For most women, the pancreas compensates by making more insulin. But for some women, the pancreas can't keep up, and blood sugar rises. That's gestational diabetes. Now, here's what's important. Gestational diabetes can affect both the mother and the baby. High blood sugar in the mother can cause the baby to grow larger than normal, which creates complications during delivery. It increases the risk of the baby being born with low blood sugar. It increases the risk of jaundice. The baby is at higher risk of developing obesity and type 2 diabetes later in life. For the mother, gestational diabetes increases her risk of developing type 2 diabetes after pregnancy. About 1 in 4 women who have gestational diabetes will develop type 2 diabetes within 5 to 10 years. The good news is that gestational diabetes is manageable. With proper diet, exercise, and sometimes medication, blood sugar can be controlled during pregnancy, and the risks can be minimized. But it requires monitoring and action. The hidden damage diabetes causes. This is the part that I think people really need to understand, because this is where the real danger lies. Diabetes doesn't typically kill you with an acute crisis. Instead, it causes damage over time. Silent, invisible damage that accumulates year after year. High blood sugar damages blood vessels, all of them. The tiny capillaries in your eyes, your kidneys, your nerves, your heart. Over time, these vessels weaken, leak, and eventually stop functioning properly. Heart disease and stroke. People with diabetes have 2 to 4 times the risk of heart disease compared to people without diabetes. Why? Because high blood sugar damages the inner lining of your arteries. Plaque accumulates more easily. Clots form more readily. Your heart has to work harder. Your blood vessels become stiffer and narrower. One day, a clot blocks a coronary artery, and you have a heart attack. Or a clot blocks a vessel in your brain, and you have a stroke. Kidney damage. Your kidneys filter waste from your blood. They're incredibly delicate organs filled with tiny blood vessels. High blood sugar damages these vessels. Over time, your kidneys lose their ability to filter properly. Waste accumulates in your blood. If it progresses far enough, you need dialysis, a machine that does the work your kidneys can no longer do. Nerve damage. High blood sugar damages your nerves. This is called diabetic neuropathy. It usually starts in your feet and legs, causing numbness, tingling, or burning sensations. But it can progress to affect other parts of your body. You might lose feeling in your feet, which means you don't notice a small cut or blister. That small wound gets infected. And because diabetes also impairs your circulation, the infection doesn't heal properly. What started as a tiny cut can eventually lead to amputation. Vision loss. The blood vessels in your retina, the part of your eye that allows you to see, are incredibly delicate. High blood sugar damages them. They leak, they bleed. New vessels grow, but they're weak and fragile. This is called diabetic retinopathy, and it's a leading cause of blindness in working-age adults. Poor circulation. Diabetes damages the blood vessels in your legs and feet. Blood flow decreases. Your tissues don't get enough oxygen. Wounds don't heal. Infections develop. This is why amputation rates are so high in people with poorly controlled diabetes. Cognitive decline. Here's something people don't talk about enough. Diabetes increases your risk of dementia and cognitive decline. High blood sugar damages the small blood vessels in your brain. It causes inflammation. It affects how your brain processes glucose for energy. People with diabetes have significantly higher rates of Alzheimer's disease. The terrifying thing about all of this damage is that it happens silently. You don't feel it happening. By the time you notice symptoms, when you can't see properly, or your feet hurt, or you have chest pain, significant damage has already occurred. Common myths about diabetes. Let me address some things I hear all the time, because these myths prevent people from taking action. Only overweight people get diabetes. Absolutely not. Yes, obesity is a risk factor for type 2 diabetes, but thin people get type 2 diabetes. People at healthy weights develop it. Genetics matter, age matters, lifestyle matters, activity level matters. Someone can be thin and sedentary with poor eating habits and develop diabetes. Someone can be overweight but exercise regularly and eat well and never develop it. Weight is one factor among many. Eating sugar causes diabetes. This is so common, and it's misleading. Eating sugar doesn't directly cause diabetes, but consuming too much sugar contributes to weight gain, and excess weight increases insulin resistance. Sugar also causes blood sugar spikes, which over time can stress your pancreas. But you don't get diabetes just from eating sugar. The relationship is more complex than that. If I feel fine, I don't have diabetes. This might be the most dangerous myth of all. You can have prediabetes or early type 2 diabetes and feel completely fine. Zero symptoms. Feeling fine does not mean you're healthy. This is why screening is so important. Diabetes isn't serious. Please don't believe this. Diabetes is serious. It's the leading cause of blindness in working-age adults. It's the leading cause of kidney failure requiring dialysis. It's the leading cause of lower limb amputation. The complications of diabetes are severe and life-altering. But they're also preventable if you catch it early and manage it properly. Medication alone fixes everything. Medication helps. It's important, but it's not a magic wand. If you're on medication for diabetes but you're still eating poorly, you're still sedentary, you're still overweight, you're not addressing the root problem. You're just masking the symptom. The best outcomes come from combining medication with lifestyle changes. Warning signs everyone should know. Here are the signs that your body might be developing diabetes or prediabetes. Increased thirst. You're drinking more water than usual, but you still feel thirsty. This happens because high blood sugar pulls water out of your tissues, leaving you dehydrated. Frequent urination, especially at night. Your kidneys are trying to get rid of excess glucose by filtering it into your urine, so you urinate more often. Unexplained weight changes. This could be weight loss or weight gain. Weight loss happens because your cells can't access glucose for energy, so your body starts breaking down muscle and fat. Weight gain can happen with type 2 diabetes because of insulin resistance and the metabolic changes that occur. Fatigue. You feel tired even after sleeping. This is because your cells aren't getting the energy they need. Blurred vision. High blood sugar can cause the lens of your eye to swell, affecting your vision temporarily. Slow wound healing. Cuts, bruises, or infections take longer to heal because high blood sugar impairs your immune function and reduces blood flow. Increased hunger. Despite eating more, you still feel hungry because your cells aren't getting glucose properly. Tingling or numbness in hands or feet. This suggests nerve damage from high blood sugar. If you notice any of these signs, get your blood sugar checked. Don't wait. Don't assume it's something else. Okay, so what can you actually do? How do you prevent diabetes or manage it if you already have it? Healthy eating. This doesn't mean restrictive diets or giving up foods you love. It means eating whole foods more often than processed foods. It means including lean proteins, healthy fats, lots of vegetables, and complex carbohydrates like whole grains. It means being mindful of portions. The Mediterranean diet and the DASH diet both have strong evidence supporting their benefits for blood sugar control. Physical activity. Aim for at least 150 minutes of moderate activity per week. That's 30 minutes, 5 days a week. Walking, swimming, cycling, dancing, whatever you'll actually do. Exercise helps your muscles use glucose more effectively. It reduces insulin resistance. It helps with weight management, and it has mental health benefits too. Weight management. If you're overweight, losing even 5 to 10% of your body weight can significantly improve insulin sensitivity and reduce your diabetes risk. Sleep. Get 7 to 9 hours of quality sleep. Poor sleep increases insulin resistance. It increases hunger hormones. It affects your metabolism. If you're not sleeping well, talk to your doctor about it. Stress reduction. Chronic stress raises cortisol and other hormones that increase blood sugar. Find ways to manage stress that work for you. Meditation, yoga, time in nature, hobbies you enjoy. Regular screening. If you're 45 or older, get your blood sugar checked annually. If you have risk factors, family history, obesity, sedentary lifestyle, get screened even earlier. If you're pre-diabetic, get screened every 3 to 6 months. Medication when necessary. If lifestyle changes alone aren't enough, medication can help. There are several classes of diabetes medications, and your doctor can help determine which one is right for you. Patient success story. Let me tell you about Michael. He came to see me at 58 years old, and his recent lab work showed type 2 diabetes. His fasting glucose was 156. His A1C was 8.2. That's significantly elevated. Michael felt blindsided. He considered himself pretty healthy. He wasn't overweight. He exercised occasionally. He ate fairly well. How did he have diabetes? But as we talked through his lifestyle, the picture became clear. He was sedentary most of the day, working at a desk. His exercise occasionally really meant once a week for an hour. His diet, while not terrible, included a lot of processed foods and sugary drinks. He was chronically stressed with his job. He was sleeping only 6 hours a night. I told him he had a choice. He could take medication and continue as he was, or he could make serious lifestyle changes and potentially reverse his diabetes. Michael decided to go all in. He started walking 45 minutes every morning before work. He joined a gym and did resistance training 3 times a week. He cut out sugary drinks entirely. He started meal prepping, cooking healthy meals on Sundays, so he'd have them ready during the week. He worked with a therapist on stress management. He prioritized sleep, aiming for 8 hours a night. After 3 months, his fasting glucose had dropped to 118. After 6 months, it was 102. After a year, his A1C was 6.1. That's pre-diabetic range, but heading in the right direction. Most importantly, Michael felt better than he had in years. He had more energy. He was sleeping better. His mood improved. He wasn't thinking of these changes as restrictions. He was thinking of them as investments in himself. 2 years later, his A1C is 5.9. He no longer has diabetes. He reversed it through consistent lifestyle changes. Here's what I want you to do, starting this week. First, know your numbers. If you don't know your fasting blood sugar or your A1C, schedule an appointment and get it checked. Don't guess. Don't assume. Know where you stand. Second, assess your risk. Do you have a family history of diabetes? Are you overweight? Are you over 45? Are you sedentary? Do you have high blood pressure? The more risk factors you have, the more important it is to take action. Third, pick one thing to change. Don't try to overhaul everything at once. Pick one lifestyle change you're confident you can make. Maybe it's adding a walk to your day. Maybe it's cutting out sugary drinks. Maybe it's getting to bed 30 minutes earlier. Whatever it is, commit to it for 2 weeks and see how it feels. Fourth, talk to your doctor. If you're pre-diabetic, discuss what your options are. Discuss whether lifestyle changes alone might be enough, or whether medication might help. If you have diabetes, discuss your management plan and whether your current approach is working. Fifth, involve your family. Tell your family members what you're working on. Ask them to support you. Better yet, invite them to join you. A family that exercises together, eats well together, and prioritizes health together has much better outcomes. Here's what I want you to take home from this conversation. Diabetes is not a death sentence. It's not a condition that defines your future. What defines your future are the choices you make today. If you're pre-diabetic, you're at a crossroads. One path leads to diabetes, progressive damage, complications, loss of independence. The other path leads to reversal, better health, more energy, better blood sugar control. Which path you take is up to you. If you have type 1 diabetes, you can live a long, healthy, full life with proper insulin management and lifestyle choices. If you have type 2 diabetes, you can slow its progression, reverse it in some cases, and prevent serious complications through a combination of medication and lifestyle changes. The key is catching it early. The key is taking it seriously. The key is understanding that you have more power over your health than you might think. Millions of people have transformed their health after a diabetes diagnosis. They've lost weight. They've gained energy. They've prevented heart attacks and strokes and amputations. They've reclaimed their health. You can too. I want to hear from you. Have you or a loved one been affected by diabetes? What surprised you most in this conversation? Drop your thoughts in the comments. Let's build a community where we're all supporting each other on the journey to better health. And if this video was helpful, please like it. Subscribe so you don't miss future videos on health topics that could change your life. Share this with your family members who might benefit from understanding diabetes better. You never know whose life you might change by sharing this. Thank you for watching. Take care of yourself, because you're worth it.